If you want to fix an L4, L5 disc bulge fast, so you can sit longer, move without pain, and finally stop waking up stiff, but everything you try either spikes your pain, sends nerve zaps down your leg, or leaves you terrified you're making the disc worse, then keep watching. The issue is not your effort. The real problem is that the exercises that you've been given increase disc pressure, irritate the sciatic nerve, and stress the area that's already sensitive. In this video, I'm going to walk you through the exact 5 exercise sequence we use with every disc bulge patient in our clinic. Decompression, nerve unloading, and stabilization designed specifically to stop aggravating the disc and start actually healing it. Watch until the end because I will also show you a nighttime decompression trick that makes the disc feel better and helps you fall asleep without that constant back and leg pain. Hey, I'm Dr. Paul Barnwell, a chiropractor in Katy, Texas. For more than 10 years, I've helped people get out of pain and return to the life that they want using natural care instead of drugs and surgery. My mission is to help people understand their bodies and build long-term health so they can live with confidence and purpose. If you're dealing with chronic pain, failed treatments, repeated flare-ups, or surgery being recommended without a real plan, this channel's really for you. You deserve clear answers, not quick fixes. In this channel, you'll learn what is actually happening inside your body, what actually helps it heal naturally, and the information most people never hear in a routine doctor's appointment. So subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move towards a life with less pain and more purpose. I upload a new video every week. An L4, L5 disc bulge is one of the most common reasons people feel sharp, low back pain. They struggle to sit without symptoms building, or they feel that line of fire that goes into the glute, the hamstrings, the calf, sometimes even into the foot. We see this every day in our clinic, and it's one of the most successful case categories. We've helped hundreds of people with bulging and herniated discs avoid injections, avoid surgery, and get back to work, workouts, and sleep again. Most people are never told what's actually safe for a disc and what makes it worse. They try random stretches, generic exercises, and the pain keeps coming back because nothing is reinforcing the segment that's injured. That's why the 5 exercises in this video are chosen on purpose. They don't spike disc pressure. They don't flare the sciatic nerve. They build real stability instead of giving you short-term relief. This is the same progression we use before, during, and after spinal decompression therapy, because it consistently helps people move, sit, and sleep with less pain. These exercises are also easy to follow. You don't need a gym, no equipment, except for one, I'll go over that. 10 or 12 minutes total. No twisting, no bending under load, and no stretching through the pain. Everything is built for disc pressure management and long-term healing. So if you follow this sequence, you may begin to notice less nerve pain, less morning stiffness, better sitting tolerance, and more confidence moving again. Most importantly, you stop living in fear of your back going out every week or triggering leg pain again. Most online videos give you exercises with no logic or sequence. This video gives you the right order, the mistakes to avoid, and how to know if you're helping or harming the disc. Now, let me show you the exact sequence and how each exercise supports the healing process step by step. Okay, so the first exercise that I chose is called a modified knee to chest exercise. The reason why I chose this one first is because when we're talking about disc issues, we're talking about a compressive issue, not necessarily a flexibility issue. Now, when you have a disc bulge or disc herniation in this area, there's going to be muscle guarding, there's going to be spasm, and that can feel like it's really tight, like it needs to be stretched out. But in this case, this one is very safe. And so what this is going to do is it's going to create a very light disc pressure reduction. It's going to unload the facet joints, which is the joints that's on the back of the spine. It's going to create a calm environment for that protective muscle guarding. So here's how I'm going to show you how to do it. So the first thing is that you're going to lay on your back. And if you need someone to help you, then you can. And you can have your knees just like this. A lot of times having them up like this is going to help to reduce pressure on your low back. If you're not comfortable like this, you can always straighten one out, or you can straighten both out. I find that most patients like to have it where their knees are about at 90 degrees. And so the first thing that you're going to do is you're going to grab behind the knee and slowly pull up this way. Also, try and keep the hand behind the knee. It's more comfortable than putting it in front of the knee. With this, you tend to get some spinal flexion. What you should feel is a slight reduction in pressure in your low back. And it should feel like if you have pain that's going down your leg, that it's going to centralize. So as you hold it here, it's going to slowly come back up this way. Now, what you want to avoid is too much momentum. You don't want to jerk it up this way. So we're going to go slow. Now, if you feel an increase in pain that goes down your leg or into your glute, then don't go that far. And so we're gonna do this for reps. So you're gonna do 10 on one side. So pull up to whatever your tolerance is. So we're gonna hold it for 10 seconds, and then we're gonna bring it slowly back down. Just let it touch the table, and then we're gonna come back this way. And we're gonna do 10 reps. Hold it for 10 seconds, remember that. After you've done 10, you're gonna switch to the other side. Just like that. Slow, very simple. Remember to hold it for 10 seconds. I'm just making it shorter for you. Okay. Once you get through 10 on each side, you're gonna do that 3 times. And you really need to be doing this multiple times throughout the day. The best time to make sure if you only have so much time is do it in the morning when you wake up, even before you get out of bed, and then right before you go to bed as well. Okay, so the next one is the sciatic nerve glide. You know, when we have disc bulges, it's irritated, the nerve is irritated both mechanically and chemically. So this restores nerve mobility so that the nerve can glide back and forth and it doesn't get hung up. So just to give you a visual here, this is about how thick your sciatic nerve is. It's about the size of your pinky. So when we do the nerve glide, we're basically getting here. So this is where it travels through the muscles, and we're sliding it. Now there could be other muscles, or there can be the nerve that's gotten hung up. And as we glide it and glide it, we're starting to get more and more flexibility in it, so that if it gets hung up, we start to pull that through. Okay, so let me show you how to do it. You're going to be seated tall. One leg is going to be extended. You may not be able to see my feet, but I'll try and show you the best I can. So as you have your leg extended like this, you're going to bring your toe up and you're going to lean your head back. You may feel some slight nerve tension. That's okay. If it's too much and it's increasing your symptoms, then don't do it, or just modify it to where it's a little bit lower. Work to your own capacity. So we're going to go up like this, and then we're going to push the toe down, and we're going to go down like this. Okay, nice and slow. We're going to do 10 to 15 reps. And it should take 4 or 5 seconds to get through each rep. Nice and slow like this. Up and down. And then of course we're going to switch and we're going to do it on the other side. Good. And if you can't tell, the foot is going down like this as you're looking down, and you're coming up this way. Just imagine that nerve. It's all connected to your nervous system and your spinal column. We're basically pulling it up and down, up and down. So number 3, we're going to do the glute bridge. Again, this is very easy. If you feel any increase in pain, then don't do it. But the reason why we want to start implementing this exercise is because the glutes are your shock absorbers for the disc. It's really what gives you the stability that you have. So weak glutes force the L4 and L5 to stabilize, with the hips really should be controlling. So by starting to stimulate these, the glutes, we can get a little bit of strength back in them, which is going to help to reduce that shearing effect that's on the disc. It's going to offload pressure on the lumbar spine, it's going to improve your pelvic control, and it's going to reduce that repetitive disc shear that we talked about. So it's very easy. You're going to lay on your back. Again, you want your feet at about 90-degree bend, just like this. You're going to be driving with the heels, not the toes. And you're going to start by creating stability in the abs, okay? And then you're going to squeeze with your glutes to slowly push this up. Again, if you feel too much discomfort, then don't do it or don't go that high. And we want to go on an even line like this. Okay, so heels, squeeze your glutes together. One thing to be aware of is that if your knees start to come together like this, we're not doing what we need to do. We're not using the glutes properly. So you want them to stay completely parallel. They can be about shoulder width apart. And again, we're going to do 10 to 15 reps, nice and slow, up and down. Okay, you don't want to overarch like this. That puts more pressure on the low back, but it's a slow up, 4 or 5 seconds, and then slowly down. If you can, try not to take the pressure off the glutes when you come down. If it's hurting too much, if you're starting to feel that burn in the glutes, then you can stop and rest a while. But ideally, we're going to keep tension on those glutes all the way through this range of motion. Time for number 4. You're doing great so far. Just like number 3, we worked on the glutes. Now we're going to work on the opposite side. It's going to be the abdominals. Now, when you have disc issues, then we have instability. So What this is going to do is it's going to create stability in the core so that it reduces that micro shearing that's happening in the spine and actually teaches your brain how to use your pelvis properly. So again, it's very easy. All you're going to do is lay on your back like this. With this one, you're going to have one leg up. You can start with whichever one you're most comfortable with, okay? And then you're going to put both hands under your back. This gives you some support, okay? And then what you're going to do is you're going to almost feel like you've got a ball in your lower ab that you're trying to squeeze. So squeeze your pelvis down like this. See that? So if I'm here, you're going to squeeze this down. Okay? Hands under the back. And then you're going to lift up from the top. Bring our shoulders up. You can see I'm shaking a little bit. That's how you know you're doing it right. 2. 1, 2. 1, 2. And then you're going to switch legs and you're going to do it here. You don't want to do just the head. The head is going to come up with your shoulders, but it should be neutral as much as you can possibly handle. Now, when you come up for a rep, you're going to do 2 seconds up, 2 seconds down. If you can handle it, then don't reduce tension on the core as you come back down. So it's going to be one solid motion. So all these reps, there's still tension in the abdomen. This is really going to create that stability. You may not be able to start with that, and that's okay. So if you feel any sharp pain at all, then definitely stop. So it's that easy. Again, what you should feel is the entire core engaging, creating stability in the pelvis. And just be careful if you have any kind of sharp pain, then definitely don't continue to do it. Now for number 5, this exercise is called the Pallof press. Now you will need something like a stretchy band, or a cable machine works as well if you have access to a gym. And so what you're gonna do is we're gonna get right here. So this is chest level. I'm perpendicular to this, and you're gonna hold this right at your chest, okay? And then you're going to step out until you feel just a little bit of tension. A little bit goes a long way. You don't need to do much. And then you're going to brace your backside. We just worked on that. You're going to brace your core. You're going to stand nice and tall. Again, if there's pain, don't do it. Okay? And you're going to hold it right at your chest and simply push out forward. What you should feel is it's trying to pull you this way. You're resisting that. Okay? So core tight, glutes tight. Perpendicular, chest height, and we're going to go straight forward like this. Good, you're seeing it's trying to pull me this way. I want to be right here. Okay, and come back nice and slow. Again, I'm a fan of time under tension. So if you can complete 10 or 15 reps of this without letting go of the tension, that's really going to be the best. So we're going to go here. And then back. Count to about 5. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. That's rep number 1. You're going to do that 10 to 15 times. Do that twice a day. When you're doing the other side, you're just going to flip around to the other way. And it's as simple as that. Now, it's really important that you work up to the tension that you're comfortable with. Start very, very light, and then you can work your way up slowly by simply moving the tension just a little bit more. A little bit goes a long way, because once it gets out here, there's going to be even more tension and help you relieve some of those symptoms that you're experiencing right now. So I hope that helps. I do have one bonus for you. It's one thing I hear a lot from patients that are struggling with sciatic nerve pain, including disc issues, is that it's very difficult to sleep. As you lay down, you're going to increase pressure in the spinal canal. Because it's all sitting horizontal. So one way that you can adapt to that, or that you can help that, is 2 different things. So if you're laying on your back, with this one, you're simply going to lay on your back, and you're going to have a pillow under your legs like this. That gives some support and takes pressure off your low back. And then get yourself a towel like this, roll it up, about that size. This is just a dish towel, and you're going to put it under your back like this. That gives you some lumbar support, and it's very comfortable taking pressure off of your disc. Now, likewise, if you're a side sleeper, you can do the same thing, but now you're just going to put that pillow between your legs. You're going to lay on your side, and with your trusty towel here, you're going to put that right above that bone. You'll have to test it and find what works the best. And then, of course, you want a pillow here. Great job working through this sequence today. You now have a clear plan to calm the L4 and L5 disc, reduce nerve irritation, and move with more confidence. If you found value in this video, like and share it so more people can get real answers for their back pain instead of guessing their way through it. Let me know which exercise gave you the most relief. Was it the sciatic nerve glide or the nighttime decompression trick? Drop a comment and tell me. I want to know. And remember to subscribe if you want to understand your body better, reclaim your health, and get practical steps you can use right away to move towards a life with less pain and more purpose. If you want 3 more exercises for an L4, L5 disc bulge that you can add to this routine, go and watch this video next. Thanks.